Good morning, everybody. I think I was speaking before I started this webinar. So I'll welcome you all. Namaskar from across the country. I hope you all will enjoy this 1 hour program, next 1 hour, where we'll take you to the midwifery program. Although you all feel we have, 22 lakhs nurses in India and 22 lakhs midwives also in our country. So accordingly, we would like you to, think that why this midwifery program? We are all midwives, yes, but we are not expert in that, isn't it? We need to be expertise in that. So for an expertise, Indian Nursing Council, along with Government of India, UNFPA, WHO, ICM, and other partners, we have developed this NPM 18 months program and also NPM educator program for 6 months, wherein the main authors for this program is, Dr. Punitha and
Are they not able to hear you? Ma'am, you're muted, ma'am. Not able to hear you, Bharti.
Yes, ma'am. I was disconnected for a while. I do not know. So we have Dr. Asha Sharma, Vice President. Madam, can you wave your hand? Vice President,
Yeah.
Indian Nursing Council, who is the ex-principal of RAK College. And, the students are still very fond of her. We still get a lot of emails for Dr. Asha Sharma. I mean, a very smiling and a charming lady over here with us. And we have Mithali Adhikari. Madam, can you come on the video, please? Yeah. Madam Mithali Adhikari, Madam is the president of the SOMI, and she's also the one of the stakeholder for our midwifery program. We have our Lieutenant Colonel Dr. Savajit Kaur, our Secretary Indian Nursing Council. For some reason, her laptop is not working, so her video is not on. So, and we have.
Thank you. Thank you, Bharti.
Thank you, ma'am. And we have Dr. T. Kumar, President in the Nursing Council. He'll be joining within the next 5-10 minutes because he's busy with some other meeting. He'll just join us because we didn't want to delay the program. So we have started that. So welcome to you all. And I'll just take a few seconds to tell you about the background of the NPM program. So the Midwifery Services Initiative of India. In 2015, India became one of the 193 countries to commit to the Sustainable Development Goals, SDG, which aim to transform the world by 2030 to a more prosperous, more equal, and more secure planet for all. India has strengthened maternal and child health service in our country under the National Health Mission. India's MMR fell by nearly 68.7% over the past 25 years to an estimated 167 maternal deaths per 100,000 live births in 11-13 from an MMR of 556 in 1990. Assam continues to be the state with the highest MMR 300, followed by Uttar Pradesh, Uttaranchal, and Rajasthan. And the infant mortality rate for India is 2020 was 29.848 deaths per 1,000 live births, a decline 3.48% decline from 2019. The government of India has recently launched the Lakshya program. Launched the Lakshya labor room and maternity operations and government and improvement of initiative to provide equal quality intrapartum and immediate postpartum care, and promote respectful maternity care. Many programs are launched by MOHFW focusing on reduction of MMR, quality midwifery care provided by midwives educated to international standards, reduces maternal and newborn mortality and stillbirth rates by 83%, and with 56 improved maternal and newborn health outcomes. 87% services can be delivered by midwives educated to international standards. Midwife-led care units, MSUs, can address maternal and neonatal mortality and morbidity by promoting quality and continuity of care, and through provision of women-centric care and promoting natural births. So that is the utilization of midwife-led care units, for this which we are preparing you all. Midwife-led continuity of care reduces preterm birth by 24%. Studies conducted by White Ribbon Alliance have also highlighted the need to focus on respectful maternity care. Many programs, just a second. According to Lancet Global Health Commission, poor quality care is now a bigger barrier to reducing mortality than insufficient access to care. Recent evidence indicates that when midwives are educated to international standards and midwifery includes the provision of family planning, it could avert more than 80% of all maternal deaths, stillbirths, and neonatal deaths. Beyond preventing maternal and newborn deaths, quality midwifery care improves over 50 other health-related outcomes, including sexual and reproductive outcomes, immunization, breastfeeding, early childhood development, and postpartum depression, etc. So focus for why in Indian Nursing Council along with Government of India has taken the initiative, that is to have focus on transformative change in midwifery education and practice. I request participants not to raise their hands. We will give you, after our speaker speaks, we'll have a discussion time. We will answer all your queries. Please do not raise your hands. Create new cadre of midwives titled Nurse Practitioner in Midwifery. Prepare midwives skilled in accordance with ICM competencies. Develop midwives knowledgeable and capable of providing compassionate, women-centered, reproductive, maternal, newborn health services. Develop an enabling environment for integration of this cadre into the public health system. Nurse Practitioner in Midwifery is a post-basic diploma of 18 months residency program. Essential components for quality midwifery based on the quality maternal and newborn care framework, which is integrated in this curriculum. This prepares competent NPMs who can provide quality and compassionate care to the mother, neonate, and family, demonstrating international standards of midwifery practice based on ICM competencies. And now Dr. Punita Izilarazu, our speaker, will tell you detail about Nurse Practitioner in Midwifery and Nurse Practitioner in Midwifery Educator program. There's a guidelines to start the program. She will detail you about the guidelines. She will tell you about the admission criteria to this program, organization and implementation of this program, teaching and learning methodologies, assessment methods, scheme of examination, and the scope of practice. We also have a scope of practice clearly written for the midwifery program, NPM programs. Over to you, Dr. Punita. With this background, I request Dr. Punita Izilarazu to tell you detail about this nurse practitioner and midwifery program.
Can you all see the slides? I'm
Yes,
just
ma'am, we
waiting.
can see.
Yeah.
We can.
Okay. Very good morning to all of you. I am extremely delighted to be presenting this important initiative of Ministry of Health and Indian Nursing Council along with many partners, and this is a very, very important need of this hour. And I know many of you are gathered and listening to what we have to say to you and to share what we all know about it. And I'm really happy to see many, many of you across the country. And Mrs. Bharti has already set the stage and for this presentation, and she has already given you a beautiful introduction. And therefore, I will start from here now. I hope, we all hope that at the end of the presentation, that all of you will be able to gain an overview of the program, NPM program, and how it has to be implemented, and discuss the scope of practice for NPMs and describe briefly the NPM educator program. And I would just like to begin by reiterating the significance of launching the NPM education program. I was just going through this report of framework for action, strengthening quality midwifery education for universal health coverage by 2030, a publication by WHO, although the work has been done by WHO, UNFPA, and ICM. And these are some of the important highlights I found. I thought it will be helpful for us where we began and where we are going. This document highlights the global voices for change of midwifery education, the future of quality midwifery education, all based on the global consultation from various stakeholders, the midwives' voices that they have done globally, survey has been done, and the global research and evidence, which all of you know that we had series of Lancet publication about midwifery care, quality midwifery care and quality midwifery education, why it is needed and what are the various findings from all were published. And the highlight is 50% of the maternal deaths and over 60% of neonatal deaths arise from poor quality care. So quality midwifery care is the only solution, and strengthening midwifery education is a key step to improve quality midwifery care and thus reduce maternal, newborn maternity and morbidity. And this 7-step action, I just want to run through this mainly to see how they have proposed this 7-step action globally, which India has taken a lead and they have already started doing in so many ways. Starting from strengthening leadership and policy, India is committed to it. They have taken a lot of evidence from Lancet series and learning from various experiences. They have brought in a lot of partners to bring in public engagement and advocacy, and educational institutions have started to be prepared, practice settings. We know the UNFPA and INC has taken a lot of lead in preparing the faculty, strengthening the midwifery faculty, and also the curriculum has been made, and now we have to see how the curriculum will be implemented and how education of students take place, training take place, and the future, how it has to be monitored, evaluated, reviewed, and adjusted. So in this context, in this, various steps have already been completed, and we are in this particular process. I just want to know why we have just began this journey and how India is committed to this. And all of you know the guidelines on midwifery services in India 2018 has been published, and so many partners came forward and committed to strengthen midwifery education and particularly NPM educated training by WHO, ENFPA, UNICEF, JPIGO, Bill Gates Foundation. Several partners have come forward, and India has shown a lot of readiness to learn from experience of other countries. Just a short video clip to say that several people have gone from representatives from ministry and also representatives from various partners from Indian Nursing Council. We see Dr. Dilip over there and several partners, WHO representative, Bill Gates Foundation representative, JPIGO, and this is supported by JPIGO, and also various research evidence. And you see the first two pictures shows the British Columbia Women's Hospital, Vancouver, Canada, where this NPM is practiced. And we had several of us visiting and seeing, getting first-hand experiences. And then we know that the next two pictures show how the NPMs have different toolkits, what they use for home birthing. They practice home birthing. There are three important studies we referred, and we found that there is reduced prevalence of small for gestational age and preterm birth in a cohort study comparing antenatal midwifery that's given by NPMs and physicians' model of care. The second study said the outcomes of when compared planned home birth by NPM versus planned hospital birth by physician or by midwives, it was associated with the reduced perinatal death rate and obstetric interventions. And then the midwifery model of care, that is women-centered, family-centered, and that prioritizes informed decision-making. These are the three important characteristics we found on them. And this is associated with women's satisfaction, cost savings, and reduced use of obstetric intervention. So we have a lot of evidence from other countries too, which India also had used it to learn from observation directly. And ministry has taken a lot of effort in learning, and India's commitment by Indian Nursing Council, again, we see here. And this particular training cascade, the Midwifery Service Initiative, will tell us where we stand and why we are moving forward with this NPM program. The first one, they decided that recruitment of midwifery educators by state governments, 6 trainers from every state, and training of midwifery educators at national midwifery training centers. They have midwifery training and NMTA institutes. 6 have been identified by Ministry of Health and Family Welfare, and also INC had been representative along with the visits that they have made to finalize this. And we had 6 finalized, like Fernandez Foundation, Hyderabad, Telangana, Kasturba Gandhi Institute of Nursing, Wada, Maharashtra, Gujarat Institute of Nursing Education, Ahmedabad, Gujarat, Regional College of Nursing, Guwahati, Assam, Rani Durgavati College of Nursing, Jabalpur, MP, and SUBP College of Nursing, Meerut, UP. These are 6 which have been finalized, and they have already started in one Fernandez Foundation, and there had been hiccups and there had been various challenges due to the COVID-19. So they did start and did have external mentors coming in, external faculty coming overseas, faculty, midwifery faculty coming in there, started, but still, because of the COVID, there had been some interruptions that many of you might have heard about it. And these midwifery educators will be posted at state midwifery training institutes, and they will train the NPM's 18 months program, and they will be mentored by midwifery educators, and they will be deployed at Lakshya certified facilities, and midwife-led care units are expected to be established in these centers first, and trained NPMs will be mentored by midwifery educators. Now, why I gave that particular background is mainly to see how we have brought in this or proposed this new educational system, NPM educational system, as specialty of midwifery. All of you know that in our education, BSc or GNM, or all are registered nurses and registered midwives. And this has been brought up as a specialty, although all these our own regular midwives have taken part in bringing down the maternal mortality rate. However, specialized midwives will be able to achieve much more. So what is proposed is a transformative change in the curriculum, and the curriculum development hasn't take place just like how it was took place earlier. This a curriculum development started at the national level with the National Task Force Committee, Minister of Health, Family Welfare, INC, WHO, ICM representatives, various other partners, SOMI, FOGSI. So many of us came together to review the curriculum that is prepared by INC, and then lot of refinement has taken place, and the curriculum prepared by INC has been endorsed by Ministry of Health, Family Welfare. And the transformative educational approach that is proposed is competency-based education and training, facilitated by mastery and experiential learning. And the main focus is on ICM competencies and evidence-based midwifery care. Here we have brought in ICM competencies and evidence-based midwifery care. We are expected to teach this component more than what we have done before. And the second important aspect is relationship-based education, where we are expected to give student-centered education. When we develop relationship between faculty and students, and it is student-centered, they will be prepared to provide women-centered continuity of care and respectful maternal newborn care. The students need to get respectful care from the teachers, and they need to get the center of education they should be, and in turn they are expected to provide women-centered continuity of care and respectful maternal and newborn care. This is something which is very, very important and a new way that we need to move forward. Compassionate care focus has come. Respectful maternal newborn care, a lot of research has gone. All of you must be wondering why respectful maternal care. Did we not study how important it is to give respect irrespective of creed and caste and so on, and why we are doing it now? There is a lot of research evidence about the disrespect and abuse in childbirth, and the domains that identify are physical abuse, non-consented care, non-confidential care, non-dignified care, discrimination based on specific attributes, denial of care, detention in facilities. So this is why we are talking about this, and there is more emphasis on global platform as well as in the country's platform. Because I have heard many times, and even many people commenting on this particular aspect, are we not prepared to give this kind of a care based on what we learned in our curriculum before? Why now? So I really want to emphasize that there is research and evidence. So there is a need to focus more on this particular aspect of compassion. Now we know that more technology and the relationship, within the high-tech environment, the relationship, touch, and everything is going on. And on top of it, COVID-19. So all these things have become such a challenging environment for all of us. And the latest educational technology also are exposed to this group of people from NPM educators, how to deal with the teaching learning experience and enabling environment for our students. Now, the main aim of the program, what is the main aim? To prepare a cadre of NPMs who are confident, skilled, in accordance with competencies prescribed by ICM and INC for providing high quality, respectful, dignified, compassionate, and evidence-based midwifery care to women, newborn, and family, and working autonomously with the full scope of practice as per regulations of INC and Minister of Health, Family Welfare. Here, important aspect that I would like to focus mainly on the objectives. Remember, the first important objective is to facilitate positive childbirth experience. This is very, very important. It's a normal phenomenon. However, we are preparing this group of people mainly to facilitate positive childbirth experience and to work with partnership with women, families, and other healthcare team, and advocate compassion, and also not only advocate but also to give compassionate, respectful care, and contribute to promote normal physiologic birthing, educate women individually or in groups, responsibility for own action. This is one thing which I think this particular NPM is going to keep again and again giving emphasis. You take responsibility, accountability for your own action, and you will implement everything based on within the scope of practice. Recognize abnormalities and draw evidence-based knowledge, and your intervention action should be based on evidence-based and work with legal and professional boundaries. And the next curriculum conceptual model just gives how the values are centered. All the values that I have mentioned, they are in and around, they are centered around the education based on ICM essential competencies and INC practice standards, and quality midwifery care is offered with the teaching learning new methodology proposed, and they will be, this educated trained NPMs will be able to give quality midwifery led care in India, promoting positive childbirth experience. Here you find ICM midwifery competencies, which are general competencies, and we have pre-pregnancy and antenatal care, care during labor and birth, ongoing care of women and newborns. The ICM Essential Competencies 2018. There is a document which gives all these in details, and all these competencies are threaded into every course of the curriculum. Please remember, I'm going to give you one example so you will know how these ICM competencies are threaded into that. Like general competencies have 13 competencies, and what is more emphasis is respectful communication, evidence-based care, and accountability. And then the pre-pregnancy, 9 sub-competencies are listed, and care during labor, 3 competencies are listed, and ongoing care of women, 6 sub-competencies are listed. I'm not going into the detail, the document will say, and you have everything in the net, and you will be able to identify that. So this 18 months program, we must remember there are a lot of discussion that took place. With the global evidence, it is proposed 18 months residency, 18 months midwifery program. And we had earlier 1 year nurse practitioner midwifery program, post-basic diploma already by Indian Nursing Council, which we have NPMs in, which are prepared by that 1 year in Gujarat and West Bengal. And now there are a lot of discussion, we need to increase to 18 months because of global evidence said that 18 months is must for a midwife who could give a skilled, competent care to, or safe care to mothers and children and families. And this program utilizes competency-based education, mastery and experiential learning, transformational and relationship-based teaching. And the curriculum, the curriculum has got a syllabus with 3 important modules: foundations to midwifery, normal pregnancy, birth, postpartum care of newborn, complex care of woman, and care of compromised newborn. And the first module, if you look at the first 3 modules, the first module focuses on readying the student for the role as an autonomous midwife practitioner working in advocating the new model of midwifery-led care in India. The second module provides opportunity. So the first module gives the background, getting ready the student for the new role, the midwife-led care in India. So this has Indian healthcare system, the healthcare scenario in India, the professionalism and professional midwifery practice, women-centered, continuity of midwifery care, respectful maternity newborn care, humanization of child and impact of communication and childbirth, legal issues, ethical issues, education and counseling, and community engagement and research informed practice. So this is readying them for their new role. And theory has 90 hours, practicum 200 hours, which includes 26 skill lab and 180 clinical. The module 2 provides opportunity to develop contemporary midwifery knowledge, skills and values with a focus on promoting normal pregnancy, birth and puerperium, including healthy fetal and neonatal development. Here basic sciences apply to midwifery, normal pregnancy, birth and puerperium and care of the newborn. Theory 100 hours and skill lab 14, clinical 980 hours. Third one is mainly focusing on deviation from normal, including complex care of the woman and newborn, as well as the midwife's role in primary health care. So here this includes complex care of woman and compromised newborn, which has 40 theory hours and 35 skill lab hours and clinical 570. And a total of all these course modules, including theory, practicum, will be 2055 hours. And then the internship is 1035. Internship is 6 months and 12 months. This is a clinical residency program. I'm going to explain that further. The guidelines for starting the program: the government, non-government BSc nursing education institution can start this program, and they need to get recognition from State Nursing Council and State Nursing Exam Board, that is approved by INC. And INC requirements, the suitability by INC has to be obtained, and 30 maximum seat. The various clinical requirements are completely listed in the syllabus, the curriculum of INC. I'm going to highlight some of the main things. This, particularly the number of seats 30 and maximum 30 per year. Staffing is NPM faculty, medical preceptor, guest faculty. Here you find the NPM faculty should be MSc nursing with OBG or pediatrics or community health nursing specialty, or BSc nursing with NPM educated training. One who has already had NPM educated training, who is a BSc, also can be taken here. I think it is not immediate. It will be later. Once we have enough of masters with NPM educator, then there should not be a problem. So NPM educator. But in the educator, NPM educator training, Ministry of Health has proposed external faculty, international faculty trainers, and we brought in, but COVID-19 has suspended that because we don't have NPMs in the country for the first time. We need to learn from the other countries who has already got. So from UK, many of the external faculty came in and started working with the Fernandez Foundation, whereas now at present we are not able to bring in people. That is why a lot of support by the partners have been committed, and which hope to be regained later on. And the medical preceptor, the medical faculty from OG, pediatrics and public health with 3 years post-PG experience or consultant, and guest faculty from NHM, Ministry of Health, family officials and experts from other areas can be, specialty can be brought in. The training sites under Government India Midwifery Initiative. Government has given a guide note, particularly guidance note for every state how to go about doing that. That is very specific. I am integrating into into our INC curriculum some of them, which is very specific by the Ministry of Health guidelines. And it is a state midwifery training institute, and the state training institute will be established. This is at the government level, state government level, will be established by state government at any one of the government BSc nursing institutes. And preference, they have suggested they should be given to institutions strengthened under pre-service education program, national or state nodal center, which they have already got a lot of strengthening done by the government. 30 candidates a year. and the institution must be attached to maternity clinical practice site and adequate caseload for hands-on experience. The various clinical requirements, INC requirements for clinical facilities are listed in the curriculum, where the 100 to 200 bedded parent hospital with minimum 50 maternity beds should be there, a labor room as per the Lakshya guidelines of Government of India, and minimum 6 labor tables, maternal neonatal units, case load of minimum 6,000 deliveries per year, and maternity OT, obstetric HDU or ICU, separate kangaroo mother care unit, and level 2 neonatal beds 8 to 10. These are affiliation for other tertiary hospitals or level 3 neonatal bed. These are all INC requirements for clinical facilities, and it will be attached to this kind of facility. Have good training infrastructure, skill lab, library, computer lab or simulation lab, adequate classrooms for theory sessions, and accommodation facility for NPMs. The admission criteria is that registered nurse and midwife, either diploma or BSc nursing qualification, minimum of 2-year clinical experience in the maternity area, age is 45 years or younger at the time of admission. And the selection process, competency assessment, and this would include various aspects like written test and ASCII, objective structure, clinical examination, and interview. And here you will find that written test has got 40%, weightage is divided 40, 20, and then 40. Fresh candidates can be recruited by the state on contractual basis. In-service candidates existing contractual candidates can be deputed, and contractual staff can be against the regular position staff who are deputed for NPM training. In-service candidates, they are also eligible for admission, will be receiving their regular salary, and being a residency program, the other students undergoing this particular program will be given salary as stipend equivalent to the counterparts in the respective organization. Now, how is this program organized? I'm giving more time for the NPM 18 months program, educator program, only by the NMTA, National Midwife Training Institute. So I will just highlight some of the important thing. Here I'll take a little more time on this. The distribution is 1.5 years, 78 weeks. The first 12 months is 52 weeks, and it is divided for theory and practical 46 weeks. Next 6 weeks are given for exams, preparation, leave, all the other leave, expected annual, casual, sick leave, public holidays, all that put together 6 weeks we have put. The second 6 months is 26 weeks of internship, annually, casual leave. This again is 2 weeks. And exam will be competency assessment exam for 1 week. So the internship experience is 23 weeks. So 3 weeks is given like this, and 23 weeks is for clinical intensive practicum, clinical practicum. So totally 78 is divided into 12 months and 6 months, 52 weeks and 26 weeks. How do we implement this curriculum? The first 12 months is suggested the block classes for 3 weeks, 40 hours, 120 hours. So that will be full theory block classes, where theory will be 90 and skill lab 30 hours. This is what is proposed. This is there in the INC curriculum. And the clinical residency of 43 weeks into 45 hours per week is 1935 hours. Here it is divided into 140 hours of theory, 65 hours of skill lab, and 1730 hours of clinical. And this is integrated into the clinical experience through faculty lecture, clinical rounds, clinical presentation, drug presentation. And it is flexible with different shifts and on-call every week or fortnight. See, the clinical residency is even for when it is for the in-service and resident group of people, they will be working like other staff, having all the other regulations. They may work in different shifts on call, and their theory and skill lab hours are integrated into their clinical practice through maybe a guest lecture of 1 or 2 hours per week, and the interdisciplinary rounds, nursing rounds, along with the OBG rounds, the clinical presentation that you do in the clinical, along with the patient with the rounds or in the conference room, the drug presentation, what you do, everything in the clinical area, because it's the clinical residency, which you will organize it in such a way that it is integrated into the clinical area. Individual group research project is also expected. So in this, how you will give, for example, I have given the theory that has to be given, can be given in terms of lecture, rounds, and clinical presentation. For example, first 35 weeks, you can take 5 to 6 hours per week. And that can be divided between theory and skill lab. That means only 4 or 5 to 6 hours the whole week, you will take them for these kind of learning experience right in the clinical area. Only thing is you will dedicate them. You will give them clinical presentation, or you will tell them nursing rounds for them to present. That could be done along with the, within the drug presentation can be, or the nursing care presentations, all that can be in the rounds also it can be in the conference room within the clinical area. And maybe a guest lecture, you get them together for a theory maybe once a week, that's all. So this can be integrated into the clinical practice, and the last 6 weeks you can use them maybe just 2 hours per week for revision. So these kind of things can be arranged in a clinical residency. This is what is being done in all the PGs in the medical. So they are all used to it. And nursing, we don't have a clinical residency kind of a program. The first clinical residency program that we started in the NPCC, that nurse practitioner in critical care, it is going on fine. And it is taking up much more progress in the recent past. And a small group research project can be conducted in the clinical posting time. And this is just a listing down of the various clinical posting with all the different clinical areas listed down. It's all found in the syllabus. And the internship, what are the various clinical areas you will send them during internship. And in the NPM curriculum, the syllabus of every course is given. And the course outline, I will give you an example how the course outline is written. And the clinical logbook, what are the procedural competencies that you are expected, you are trained and you are expected to practice. And what all independently you can do, and what all collaboratively you can do, and what are things that you can refer, what you have learned. And this particular procedural list is included in the scope of practice that is being prepared. The clinical requirements, what are the requirements for the students for this program? What are the various learning resources and the scope of practice? The example of course module Foundations to Midwifery, it gives out what is the theory hours, practicum, and both skill lab and clinical. What is a course aim? What is a course description? And what are the course objectives? And specifically competencies I have put down, being a competency-based program, where the ICM, the Foundations to Midwifery, we have integrated the ICM general competencies. Same way, every course module will integrate the ICM competencies. Here you will find there are 1A to 1H general competencies which are spelled out in ICM. And all these competencies are within the curricular content. The syllabus content will prepare them for these general competencies. So this is how we have prepared every course module, all the module number 1, 2, and 3. This is just an example. And the teaching learning, the process is underpinned by respect, with educators modeling the respectful care and communication that these graduates will engage with women, and the student is intentionally placed in the center of learning, becomes directly involved in the process of constructing knowledge. And experiential learning, scenario-based learning, reflective practice, simulations. Remember, all these type of learning experiences, when you're planning, it will involve a lot of effort on the part of the faculty. However, the learning will become much more clearer and more effective when we use these kind of teaching learning experiences. And this is spelled out here in classroom, what you can use, skill lab, what we can use, and the clinicals like tutorials, lecture, experiential learning, and self-directed learning, PBLs, problem-based, practice teaching, micro teaching, audio-visual, audio-video assisted, virtual learning, and safe delivery app, and skill lab, what all you can, scenario-based learning, OSCE, role play, micro teaching, and clinical bedside clinics, reflective learning, experiential learning, case presentation, case studies, rounds, conference, drug study. See, these are all field visits, use of logbook. These are some of the specific teaching learning methods that you can use. And you know, the safe delivery app is a high-tech kind of a thing that can be used. And this is the education technology based learning, which can be incorporated throughout the curriculum by integration of safe delivery app. We have introduced the safe delivery app to the midwifery faculty when we had virtual training, which is supported by UNFPA, is done by UNFPA and Indian Nursing Council. When preparing the midwifery faculty, we are having virtual training. Nearly 10 training sessions have been completed. More than 1,000 people have been trained by that, and safe delivery app is what is oriented to them, and it is being given to them, and they all of them have gone through the safe delivery app. It is a smartphone application that provides direct instant access to evidence-based and up-to-date clinical guidelines, and this is used as a teaching learning tool that covers 11 modules, and every module is self-learning, and then at the end of it you will become you can get a certification. So that is the safe delivery app that can be used. The various and we are hoping that even in the BSc curriculum, that safe delivery app will be included as a mandatory module for the final year students. And the assessment methods could be some of the methods that is given: seminar, self-assessment, written assessment, case study, and literature review, OSCEs, practical assessment, written exams, and competency assessment, quiz, online learning activities, and class presentation, debates, peer review, and so on. These are some of the methods that has been spelled out which can be used. And the scheme of examination tells that they have only theory 2 papers. Module 1 is foundation is 1 paper, and 2 and 3 are paper 2. And this is the mark distribution, and practical is midwifery, and this is more 100, 100, and equal for internal and external assessment. This is a scheme of examination, and I would like to spell out a little more on the practical examination. But regular examination regulations are authority, examining authority, respective examination boards approved by the council. Eligibility is percentage of attendance in theory, practical 90%. Candidate should complete the necessary requirements and should make up 100% before certification, and supplementary after 6 months in the failed paper, either theory, practical, number of attempts 3, and the pattern also is given in the syllabus. What is the distribution for internal for 25 marks? What are the things that they have to use them? Test, assignments, presentation, and external 75 MCQ, short answers, and essay or scenarios. That also is spelled out. And practical again, 100 marks, 24 the overall clinical performance throughout the year, and 24 assignments clinical, 20 for OSCE, and 40 for directly observed practical. Same way external, OSCE, and directly observed practicals. And practical examination, how many students can be, the per day 10, and there are panel of examiners are 3. Here you find a very major difference that the NPM educators, 2 will be examining, 1 internal and 1 external. They are the NPM educators of the faculty, trainers, and 1 medical preceptors. Every student will have 1 NPM educator at the rate of 1:10. That means both educator as well as medical preceptor. So the examiner, the medical preceptor, one of them will be an examiner. And so there will be a panel of 3 examiners. And both the NPM educator and the medical preceptor should be familiar and involved in the NPM program. The qualification, NPM educator or MSc with OBG with 5 years teaching and clinical experience, and MSc OBG with 5 years teaching as faculty with a minimum of 2 years midwifery clinical. We have made a little bit of leniency because this is a first time program and we don't have already well prepared faculty or NPM educators. So we may have to wait until we have adequate number of NPM educators. And medical faculty or preceptor from OBG and pediatrics, public health with 3 years post PG experience and as a consultant. Certification title is Nurse Practitioner in Midwifery, and this is awarded upon successful completion when they have completed the prescribed course for 18 months, completed 90% theoretical, 100% practical hours before certification, and passed 70% is the pass mark, and both internal, external put together 70%. And certification is by exam boards approved by INC, and the State Nursing Council will be registering NPM as an additional qualification. So to summarize the roles and responsibility of NPM, who will be prepared through the NPM program, they will be posted in midwife-led care units. They have to apply through this midwife-led care unit. And in the government setup, those who are sponsored, they will be posted in these areas, high case load areas. They work in collaboration with other maternity care team members, provide respectful maternity newborn care, and provide continuum of care, conduct ANC clinic and counseling, perform triaging in collaboration with obstetrician or specialists, promote and manage physiologic normal births, identify complications, provide emergency care based on established protocols. It's all protocols will be established and within the scope of practice will be defined, and refer complicated cases to appropriate facility, provide RMNCH plus A services, teach and mentor other team members. So the scope of practice, I would just like to summarize and give the highlights. And India's definition of midwife is very specifically given. That means they complete 18-month course, and which is recognized in India, designed by Indian Nursing Council, which is based on ICM essential competencies, who will be registered, legally licensed to practice midwifery under the title Nurse Practitioner Midwife, demonstrating competency in the practice of midwifery. That's India's definition of midwife, which is adapted from ICM definition. And these are the key principles that apply to NPMs. What are the authority? Everything, accountability, responsibility within the legal scope, education and counseling, advocacy, order and interpret diagnostic procedures and lab tests based on national guidelines, prescribe selected medications again as per national guidelines. Already NHM, those staff functioning under them, they have protocols as per national guidelines on these 2 areas. So they will be using them, providing care for women and families using best evidence, referrals they do, documentation and report and support regular reviews. So these are the key principles that apply. And the boundaries for NPM practice, this has been taken from purely from ICM, and ICM has given these boundaries, and these boundaries have been taken for the Indian midwives too, in pre-pregnancy care, where the sexual and reproductive health is given, providing family planning counseling services, addressing issues on sexual gender-based violence, provide preconception care and counseling, perform measures in prevention and screening for sexually transmitted infections, and antenatal care, again, assessment, detection of confirmation of pregnancy, complications, lab tests, monitoring, and then also promotion of promote and support healthy behaviors, improve the well-being and antenatal education, and then provide care of normal pregnancy, identify, manage women with complicated pregnancy, initiate birth preparedness for women and family, and provide care to women with unintended or mistimed pregnancy, provide abortion and post-abortion care. This is antenatal. Same way, care during labor and birth, intrapartum care is spelled out, confirming the onset of labor, supportive, respectful care, identifying, that means facilitating alternative birthing position, birth companionship, and informed, respecting women's choices, identify labor complication, immediate management and referral, assisting normal birth, facilitating physiological process and safe birth, immediate essential newborn care, provide immediate essential newborn care, neonatal resuscitation, identify, perform immediate management referral for newborn complication, and perform episiotomy only if necessary, and repair perineal lacerations, that is excluding third and fourth degree or complicated tears, may include management of shoulder dystocia, initial management of fetal distress, cord prolapse, etc. And ongoing care of women and newborns, postpartum care. Here again, what are the postnatal care in terms of continuing assessment, health assessment and health education support, and identification of complications, family planning services, and supporting maternal and infant bonding, identify and perform immediate management, initiate referrals, counsel and provide postpartum family planning services, and provide anticipatory guidance for mother and newborn on complications, readiness, and recognition of danger sign. So these are the boundaries that have been given under these four major headings. It started from pre-pregnancy care, antenatal care, care during labor and birth, ongoing care of women and newborns. So that is the entire scope of practice, and the scope of practice will go in line with the educational preparation and all the specific procedural competencies and all competencies ICM listed and trained, educated and trained by the NPM educator will form within the legal boundaries, will form the scope of practice. And the scope of practice will be integrated into the upcoming nursing bill or act or commission. A few points in terms of NPM educator curriculum. This will be done only by the 6 national midwifery training institutes. So I'm not going to take a lot of time on that. I will quickly rush through. Here, what is the aim of the curriculum? Preparing competent NPM educators, and what are various objectives in terms of transformational education, and also WHO midwifery educator competencies and ICM essential competencies are integrated into the curriculum. And they are expected to be a role model for skilled, women-centered, compassionate, respectful maternity care. That's very, very important. And they have the ability, they demonstrate to use experiential learning methodology and commitment to humanization. And here again, the curriculum conceptual model has got the center, the relationship-based care and education is what they are going to model. Student-centered learning, women-centered care, and using the WHO educator competencies and ICM essential competencies. And what they are going to give the competency-based experiential learning in order to provide quality midwifery care. So this education will be a transformative midwifery educational model, which is envisaged in the curriculum. And this is the midwifery educator competencies. There are 8 competencies. It is recommended by WHO. I'm not going in detail, particularly ethics, then practice, theory, learning in clinical area, assessment, evaluation, organization, management, supervision, communication, and research. These are the 8 major areas. The guidelines to run through, some of them are staffing, faculty. These are INC guideline, faculty trainer, that is the teacher, then medical preceptors, guest faculty they have the same way. And here the faculty student ratio is 1:5. There the student faculty ratio and preceptor student ratio is 1:10, whereas NPM educator it is 1:5. The training sites are National Midwifery Training Institute, selected after inspection by Central Scheme. 30, that's the team members which are proposed by Ministry of Health, but in INC and other partners visited and identify these areas. 30 candidates every 6 months. The institution again must be attached to the maternity clinical practice side as per INC guideline. Good infrastructure, training infrastructure, classrooms and facility for NPM educators. The admission criteria here, the registered nurse and registered midwife, and educator should be MSc nursing with specialty in obstetrics, gynecology or pediatrics or community health, having 2 years of clinical maternity experience, or BSc nursing with nurse practitioners midwifery, those who have already had nurse practitioner midwifery, 2 years of clinical experience. Selection, written exam, ASCII and interview like 40, 20 and 40. This is the selection criteria. In-service candidates are also eligible for admission and receiving the same salary, regular salary, because this is again a residency program, where it's a 6 months of residency program and 12 months of mentorship program. This 6 months residency again competency-based, experiential, transformational, and relationship-based teaching and learning. 12 months structured mentorship using logbook, portfolio, reflection of experience, mentorship, and peer support. Here the modules, they have 4 modules. There they had 3 modules. Here, preparing midwives for relationship-based transformative midwifery care, preparing midwives for care during pregnancy, birth, puerperium, preparing midwives to lead, manage, supervise quality midwifery care, preparing midwives for evidence-based midwifery. These are 4 modules, where the first module will prepare them, how to deliver them, prepare the NPMs in relation to this, relationships transformative, and total 140 hours theory, 40 hours skill lab, and 840 hours of clinical. This is for 6 months. And organization, this 26 weeks is given in 23 weeks. 3 weeks are for examination and holidays. And this 23 weeks, 10-20 hours are distributed to theory block of 3 weeks and clinical residency of 20 weeks. And the curriculum gives all the courses, all the 4 course modules with the content outline and teaching learning experiences and clinical logbook, requirements, learning resources, and scope of practice. The examination regulations, here again exam boards, examining authority. End of 3 months, they are given a competency-based exam, and if they don't pass, they are sent back, reassess at the end of 6 months, final assessment at the end of 18 months, and similar examination pattern is given for all 3 examination. Eligibility for admission to examination, 90% theory and practical, and on completion of all clinical requirements. Supplementary, failed candidates after 6 weeks in either theory or practical which they have failed, and number of attempts is 3. Certification, just like NPM, this is given on successful completion of the program, and 90% theory and 100% practical, and 70% both internal, external. Certification by exam boards approved by INC, and State Nursing Council will be registering NPM educator as additional qualification. The NPM educators' roles and responsibilities are mainly, I've just put, they need to ensure implementation of the program. They are posted in the state midwifery training institutes as per INC curriculum. They will implement and continuously update their knowledge and participate in professional development activities. They practice in the clinical facility. They will be delivering, providing midwifery care, and also they will be mentoring NPMs. This is what the main roles and responsibilities of NPM educators. So this and the scope of practice remains for NPM and NPM educators, both are same. And this is an overview which we intended to give you in a webinar. And we have a separate complete curriculum for NPMs 18-month program, a separate curriculum for NPM educator for a 6-month program, clinical residency, plus 12-month mentorship program, because after 6 months, they are placed in their state midwifery institutes where they will be practicing and they will be mentored by the NPM educator. So this is their roles and responsibilities. Both NPMs as well as the NPM educators have been summarized, and you can always look at the INC website where the curriculum has been placed, and all the Ministry of Guidelines, Ministry of Health guidelines are placed by the Ministry of Health publications in the INC website. So the Ministry of Health and Welfare guidance note will very clearly state for the National Midwife Training Institutes as well as State Midwife Training Institute, what the expectation, how they are selected, how they are placed, and how their cadre positions have to be developed in every state. All the guidance will be placed in that guidance note, which please look at the INC website and update yourself. And it's impossible to say everything within an hour's time. So I have tried to summarize, highlight important aspects of both the curriculum and particularly NPM curriculum more in detail. So to conclude, I must say that the curriculum for NPM and NPM educator has been planned diligently by INC, endorsed by Ministry of Health, Family Welfare, based on India's commitment and initiatives to provide quality midwifery services to the people of India, thus reduce maternal neonatal mortality. But I must say, the success of the program and provision of quality of care depends to a large extent on the effective curriculum implementation, should be followed by creation of cadre, positioning of NPMs in all states as envisaged by Ministry of Health and Family Welfare, Government of India, and continued professional development by NPMs. It is not finished, just a beginning. They need to continuously update their knowledge as they practice. So we are in the beginning of developing. The programs are developed and we have to train them, educate them, and then we have to see, review, evaluate, and see how they are functioning. So this is how I would like to conclude. So implementation, cadre development, positioning, continued professional development are very, very essential for providing quality care and quality midwifery education. Thank you. Thank you for your patient listening, and thankful for the opportunity.
Thank you so much, ma'am. It was so informative. It was very, very informative. I think many would have gained the knowledge about NPMs. But I think we do have a lot of question and answers on very simple things also. I request all the panelists to, ma'am, can you just close the PPT, please?
Right?
Yes, ma'am. Thank you. So here, this is not a meeting. So I think the participants should not raise the hand because we do not have an audio for the participants over here. It's better to put your questions in question and answers. We do have many questions over here. So I will ask the panelists one by one to please answer the queries. I think Madam Mithali Adhikari, if you can put your video on.
Yes, ma'am.
Yeah, yeah, yeah.
Yes, ma'am.
We have first question. I mean, we have many questions on NPCC. I think we are here doing today on the NPM and NPM educated program. We will not be able to answer NPMs. NPCC, I mean, sorry, NPCC. So one of them, anonymous attendee, I will not take anybody's name here. Can you please enumerate the 6 NMTIs again? I think President, sir.
First of all, I would like to congratulate all the participants to shown the interest of knowing the new initiative of the Government of India and the Indian Nursing Council. I think in the introduction, the how this whole program has been conceptualized and how this syllabus has been conceptualized, all the things have been has been mentioned. So to start with, the six, I think Dr. Punita mentioned. The one is the Fernandez institution from
Foundation.
Telangana, and that's the one program which started. It is not yet completed, and we have in Maharashtra Wardha, and we have in Madhya Pradesh. I think some. What is the
Can
name?
I add?
Huh?
Can I add, sir?
Rani Durgavati,
Rani Durgavati. Okay.
College of Nursing.
Rani Durgavati,
Mm.
and in Meerut,
SVBP.
That's 4. In 2 is I think
SBPP. SBPP as
SV.
Meerut.
Gujarat.
Rajesh.
SVP, I told that Meerut. And
Meerut. Yes, sir. Yes, sir.
Gujarat Institute of Nursing, Gujarat.
Mm.
More
And Regional College of Nursing, Guwahati.
Guwahati. Okay, Guwahati. These are
And Gujarat Institute of Nursing, Ahmedabad. Okay, sir.
Okay.
One is the Fernandez, second is the Kasturba Gandhi Institute of Nursing, that is Sevagram, Wardha, Maharashtra. Third is the Gujarat Institute of Nursing, Education and Research, Ahmedabad, Gujarat. Regional College of Nursing, Guwahati, Assam. Rani Durgavati College of Nursing, Jabalpur, Madhya Pradesh. And SBBP College of Nursing, Meerut. Only 6. Rajasthan is pending, sir.
okay. Next question, Bharti.
Where can a senior midwifery teacher who is above 45 years age, working in private setup, highly motivated to contribute, fit in the system of nurse practitioner midwifery? Any panelists would like to answer this question? I will throw to all.
See,
This
if
is
you
a
see
question
the whole concept of the nurse practitioner midwifery program, I think they have already calculated on the basis of where all these midwifery-led units are going to be created by the National Health Mission. I think one of the very important challenging and the nursing fraternity in India facing about the creation of the positions. I think always we Indian Nursing Council, we are good in preparing the curriculums, but we know these 14 specialities which are no takers. Even in the nurse practitioner midwifery program also which we launched, there are not many takers except when West Bengal and Gujarat, the positions were created. And again, we saw the challenge in Gujarat, even positioning the 25 posts of the nurse practitioner midwives are created. And still there is a challenge is being faced by the Gujarat government of filling up that post. So in this perspective, I think NHM has made a policy decision. It's a landmark policy decision, which we know that anything we do, states are not coming forward to create positions. So in that context, the National Health Mission has committed in the midwifery guideline. If you go through the midwifery guideline, they have made a calculation. Whole country requires about 84,000 nurse practitioner midwives. So and they have said to start with, it is going to be started in the government nursing colleges. They have also made an assessment in that about 143 nursing colleges has been identified in that. The remaining has uh, to be identified in the private sector. So now they are going with a public-private partnership program is going to be created for the private sector. It will be impossible to train the 84,000 the nurse practitioner midwives with the existing 143. They have made a calculation. There is a lot of operational plan has been delineated in this midwifery guideline. Please, I request all the people go through that midwifery guideline, which has been released by the highest of the country in the health sector, is the our honorable health minister, and also in the presence of the partners, international partners forum, which is a very highly represented in Vigyan Bhavan, this and where the partners like FOGSI, Indian Nursing Council, Ministry of Health, WHO, and other international partners were the witness to that is a big mela in that the midwifery guideline has been released. I request all the people who are participating in the, I am very happy to say about 1,000 people have been listening to this program. I request all of you, please go through in detail. It's a very, very important, which at least in my experience, such a commitment has not come from the government. Yes, okay, I'm going to create the post. At least they have made a commitment, and that commitment is coming from the not less than the National Health Mission. You know, the National Health Mission, where there is every possibility of getting the funds. And in that, it all depends how state governments, the state National Health Mission director is going to work for the putting up the proposals to the Union National Health Mission for getting the funds. That is one thing. So therefore, the professional associations at the state level, they have to be after with the national state level health mission people to work with them to get these posts are sanctioned. And similarly, the private sector will definitely, the 5 years, whatever the one the participant has asked this question, will get a scope in the one the private sector is going to be identified for the for positioning them as a, and they're all going to be positioned in led units, and the Ministry of Health is already in the process of developing the architectural plan of the what will be the midwifery led unit look like, the architectural plan of that midwifery led unit, and what will be the minimum equipments a midwifery led unit should have, and all that has been being worked out. I know another important for the nursing and midwifery fraternity in India will be curious to know that the existing Indian Nursing Council Act is not having a scope of practice. That is one of the challenge which we had. And this scope of practice for the nursing and midwifery has already been Ministry of Health has reflected in the new Nursing and Midwifery Commission, which is going to come up, and it will have then the Nursing and Midwifery Commission will have a scope for regulation. In that regulation, all the specialty groups, not only midwifery, all the specialty groups will have a scope of having the scope of practice. So that is an opportunity. What type of but till such time, the National Health Mission has already come out with a detailed protocols, including the medicines and drugs which they can be observed. What are the protocols has to be followed has been already finalized by the NHM has been, you will be able to see those in the ministry and in the INC website. So therefore, there will be enough opportunity for the private sector to play in this very important nurse practitioner midwifery initiative, which is going to come up. So that reason, you will not be left out. Okay, next.
Thank you, sir. Mathali ma'am, if you have any idea, when is the next batch of NPM educator program starts?
Actually, it is I have not yet. It is decided, but it is under process only. Some of the states, suppose the Bihar, West Bengal, they are ready to send the nurse practitioner and NPM educator. Okay, but Government of India is deciding where it will be done. Again, it will be in the Fernandez Hospital or anywhere. As because they are bringing the educator from the UK, so it's a very costly also. So they are thinking about this only. So not yet decided, ma'am, till now.
I think whatever the Mitali has pointed
Yes,
out, since COVID has put us
yes, yes, sir.
a lot of obstacles for the midwifery
Uh,
educator program. The
uh,
first batch of even the first batch of the
that's not yet, sir.
uh,
Examination not yet conducted.
the first batch of midwifery educator program, which was held by the held in Fernandez, is also not completed. I think there is a Ministry of Health has got a lot of feedback. Even the running of this of the midwifery
Course.
educator program from the Fernandez, and there at least one good thing already Ministry of Health has taken during this COVID period is they have finalized. They have finalized the site
Mhm.
for the midwifery educator program.
Mhm.
And also the now the gradually when things comes into the normalcy, we are still some states having some the
Ready.
COVID protocols. COVID protocols are in position. I think things are going to become normal because of the vaccination which has come in. I think a lot of confidence level is being created. So once that situation comes, I think these six institutions are in position, and the six institutions. I think another thing, one important thing, the National Health Mission has been each state, each national midwifery training educator program has been entrusted to the partners. The partners will be monitoring, and the Indian Nursing Council and the Ministry of Health also will be monitoring, and so that the some of the bottlenecks which has been faced in the first program in Fernandez are going to be addressed. For example, examination is not conducted, certificate not been issued. All that is going to be taken care of, because in this there was a communication gap. The wherever these six national midwifery training educator programs are there, examination has to be conducted by the either state nursing council, or for example in some states we have the examination board. I think in all the six whatever they are proposed, we have a state nursing councils are conducting the examination. For example, in Telangana only there is a examination board is there, whereas in UP for Meerut it is a UP medical faculty
Nursing. Co-
conducting the examination. For Gujarat, it will be a Gujarat Nursing Council will be conducting the examination, and Madhya Pradesh for the Madhya Pradesh Nursing Council is the examining body, so they will be conducting. So the respective, I think that's why we have started orientation to the state nursing councils also. We are going to have a separate already guidance notes have been gone to all the states. So I also request the state level, our nursing and midwifery professional, the associations and the unions has to be very proactive for this to take up the issue with the respective mission directors, because wherever the mission director is there, I think we are seeing for the last 2 to 3 years, lot of investment is going from the National Health Mission for the nursing. I think that's a very positive development, because earlier money used to go from the Ministry of Health under the nursing section. Now the lot of the skilling and also the equipments for the audiovisual and strengthening of the many of the institutions in terms of the in terms of the skill labs, the lot of funds are released under the National Health Mission. So I am seeing whichever the state mission director is active to incorporate the proposal, send it to the National Health Mission. I think National Health Mission is very flexible, and also they are very proactive for the nursing and midwifery the proposals.
I just want to tell the panelists that we have 101 questions to be answered, so we can have to be a little faster.
I think
We
what
have,
you can club
yes,
some of the questions
no,
together.
yes. Is a nurse practitioner for community health nursing available in anywhere in India? Yes, it's in the pipeline. It is not available as of now. National nurse practitioner for primary health care is in the pipeline. It will be there within a year or so available in our country. And what is respectful maternity nursing care? Pearl, if you can just highlight on that, because you're doing a lot of virtual trainings on respectful maternal nursing care.
Yes, I'm sure.
Mhm.
So to answer that, what is respectful maternity care? Yeah, we know that as nurses and midwives, we are supposed to provide respectful care to take care of the mothers and their families who come to us with utmost respect and care. But many times in practice, when we see in our labor rooms, many times women are abused in different ways, maybe physically or verbally, and separation of the mother and baby itself is an abuse. So a lot of concepts are there behind respectful maternity care, and the UNFP and the WHO have put forth different ways how to address how to provide respectful maternity care under the charter, which is promoted by the White Ribbon Alliance. So under that we have 7 charters. So there we talk about how to prevent or how to reduce abuse for women when they undergo or when they are during the childbirth period. So there are different charters, 7 on the whole, where we talk about. First one is physical abuse, where we I'll just give one example of it because it's a huge topic to cover. For example, if we are providing episiotomy to a woman who there's no need to provide episiotomy, but for to speed up the delivery or for any other institutional protocols, if we are going to provide episiotomy, that is a kind of disrespect. And if we are not explaining the procedure to the women, or we are not taking care of her newborn, or giving any medication to the newborn without the mother's consent. So all these come under disrespectful care. So this is just an example to highlight. It's a whole lot of information related to it. So for further information on respectful maternity care, you can log on to the UNFPA website or to the WRA, White Ribbon Alliance website, and we get a lot of information there also. So it's
Uh,
a huge topic.
yeah, that's true. That's very much true. And I request anybody who is interested, who is a faculty who is teaching maternity care, midwifery, and community, and the pediatrics, can join our virtual trainings, which are available. The training calendar is available on the INC website, and you can email us to training.inc email ID so that we can uh, put you as a participant over. We can send you the link because each virtual training has a different link. Thank you, Pearl. And will NPMs be allowed to work in secondary level hospitals offering midwifery services, private and mission? I think, Presence, I think you've already answered this question, or you want to add on something on this?
I think, see, the sites where their midwifery-led units are going to be created, it is not going to be in anywhere
Not
and
yet.
everywhere. So there will be a midwifery-led units. As I said, there will be an architectural plan is being worked out, and the list of equipments a midwifery-led, these midwifery-led units are going to be staffed by the 4 to 6 nurse practitioner midwives. So the sites will be finalized more the FRUs, and more or less in the community health centers are going to be positioned, but each state will have a different guidelines. But wherever they identified the midwifery-led unit, and that the place the nurse practitioners are going to be positioned.
Yeah. Dr. Punita, the next question is for you. If any MSc nursing or BG specialty candidate is interested to join the NPM course, will it be any consideration in the course duration? Is there any chance or possibility for a private nursing faculty to get training in national training institutes to become a midwifery educator?
As per the admission criteria to become an NPM educator, the MSC's OBG on their own, they cannot become an NPM educator unless they go through the NPM educator training program. So they will be given except for the age limit, but otherwise they also will be given preference to join NPM educator. And what's the next question?
The question was like, I was also feeling that we have to tell them there's an entrance test or they have to come to the state selection to become an NPM
selection
educator. They
process.
cannot directly go to any institute to have that for the admission. They have to go through a state selection
Yeah, it
committee.
is a state selection. Right now, it's only for the state selection and entrance examination. I have said about in the selection
NPM.
process. Only admission requirement, I said MSCs can join, but they have to go through the selection process, go for the entrance where they will be writing an entrance test and also ASCII as well as interview. They have to go through all the process to get into the NPM educators.
The next question, I think it's all for all the panelists, if they can put their thought in it, because is there any chance for the private nursing college with a parent hospital to start training for NPM? It is not like any other program like NPCC or any BSc or MSc courses. It has to be through state, ministry, and INC to, I think, to start this training NPM. Am I correct?
Yes, I can give one thing. In the Bihar only, they are deciding to start NPM course in the private college. They are keeping. So PPP model only. So it is just decision of the state only.
Right, ma'am, but the NPM is not solely state, because the suitability for them to practice once it has to be a recognized qualification by the Indian Nursing Council. So they need to obtain suitability from Indian Nursing Council for the registration and work outside their state. Presence, you want to add anything, or Dr. Punita?
I think Dr. Punita mentioned that this whole process of establishment of the practitioner educator and also the NPM 18 months curriculum, I think this will be, yes, there will be a scope for the PPP model for engaging the many of the private nursing colleges which are having a parent
hospital.
In the Dr. Punita about the minimum 50 beds of the maternity beds and all that she mentioned. If they possess those the requirement, then the state government will recommend to the Indian ministry and to the Indian Nursing Council, and there will be a joint the assessment team will visiting from the Indian Nursing Council and the partner organization like UNFPA, JAPAGO, and the other organizations, WHO, and the Ministry of Health representatives will be making a joint assessment for considering for the selecting the nurse practitioner midwifery program. There will be definitely there will be enough scope. As I said, 143 nursing colleges, government nursing colleges, are not going to be only will be to train the 84,000 nurse practitioner midwives are which are required as per the assessment made by the Ministry of Health. That is the operation plan. So there will be a roping in, as already Mithali said, that already some states are identifying the private sector to be used for this thing. To enough opportunities there, if they have an infrastructure and the faculty and the caseload. So they all will depend upon this assessment. And I think you may have to be in touch with the state mission directors. I think they're going to play a very pivotal role in selections.
Thank you, sir. Then we do have Dr. Sharma, the Vice President, ma'am. Would you like to answer this question? Will this cadre be recognized by clinical establishment acts of states and NABH? Ma'am, you're muted.
Yes, of course. You see, once a program which is being, developed and endorsed by the Ministry of Health and Family Welfare, and it is a regulatory body who's offering. So I'm sure that this would be recognized, and the NAP also has to sort of take into consideration. And as far as I know, NAC and NAB both are, in agreement with the degrees and the diploma programs which are offered by the regulatory bodies. As I have attended some of their meetings, 2-3 times I have attended, and I have learned that they are interested in the cadre, in the kind of training that these people have gone. They check for these things in doing their NAB and the NAC inspections, of course.
Thank you, ma'am. That means it is recognized by clinical establishment as
Yes.
well as NPH.
Yes.
So next question is from a deemed university where I think it has already been answered at STMC or NMTI center for which they are trying have to be recognized by both the ministry as well as Indian Nursing Council as well as state government. These three are there available for the
Yes.
recognition, because it's a big new program, new cadre is being developed. So we all want to start with the help of ministry and as well as partners as well as state government. And one of the other question is answered already. And see, once midwife will be a separate cadre, what will the scope of MSc? It is not a separate cadre. What we're doing is specialist program. This will be practitioners program.
Yes.
The cadre is not like a different from the very down. So once midwife will be a separate cadre, what will the scope of MSc nursing in OBGYN guide? See, you have your own role and responsibility after having MSc OBG, but it will not be equivalent to NPMs. I think I'm right.
Yes.
So if
Yes.
anybody would like to add on with me.
I think I was also seeing some of the questions once this NPM program is rolled out. So it should have a separate, there is no need to have a registered nurse and all. No, see, India is a country. I think this is where we were had a lot of dialogue with the Ministry of Health, that this is a nurse practitioner midwifery. These are the courses, like critical care is one, is already been rolled out. I know some of the questions some of the participants were asking about the registration and all. I think we have seen only 2 institutions successfully completed the NPCC program. If anywhere you have completed, if you have a problem in registration, please write to us. We will take it up with the respective state nursing councils. Once they have completed the course of instruction and approved by the Indian Nursing Council, there will not be a problem doing the examination by the examination boards. So we have to have I think there are many models globally, and that is the reason the ICM is very categorically, they said, they have made it a point that any nurse to become a midwife. That means that's the reason they have said 18 months is the minimum duration, has been spelled out by the ICM. So that recommendation only the Indian Nursing Council argued with the Ministry of Health, that's how the 18 months was prescribed. So we do continue to have the I think India is the one country, even when we go to the home visiting, even the community health nurses, we can't see. I am not a pediatric nurse. I will not see this. I am not a OBG nurse. I don't see it. We are, we are all trained in a comprehensive primary health care. So therefore, the midwifery, which is the integral part of our nursing program, it is going to be continued, and all these ICM competencies which have been which Punita has mentioned, that it has been incorporated in a BSc nursing syllabus, which has been revised, which is going to be implemented from the next academic year. Indian Nursing Council shortly is going to start the similar type of orientation program for the through virtual meeting for the orienting the new base BSc nursing curriculum. New basic BSc nursing curriculum will have these components in the midwifery, which has been incorporated. We will have to continue to have this midwifery is an integral part of training, and also for the international recognition of our the nurses and midwives in different countries when they are going. So therefore, this this NPM is a specialized program, is a specialist. So we are now gradually now at least now the critical care and the midwifery has been considered officially launched as a specialist program. Other 14 programs, you know that we have the INC has laid down, and we have also, I think you would have seen our INC website, and other big policies have been made by the Indian Nursing Council is all these specialty programs are going to be residency program. So while working in the institution itself, we can earn the this specialty program. So I think the one at the end of the day, the one of the important thing which we have to remember is as and when posts of specialists are created in the clinical setting, then only there are many takers are going to be there. But now I have interacted with many of the private sector. This residency program, the policy they are now, like for example, in oncology setting, they would like to have our 1 year oncology nursing so that no, while working in their institution itself, they'll be able to earn the this specialty post-basic diploma. So we want to, I think many of our nurses find it difficult to take 1 year leave and deputation. Also, sometimes they don't give the institution. That's why we have come out with this residency program. So therefore, these are the two to start with now. And I think many more specialty nurse practitioners are likely to come up. Already the emergency and trauma, All India Institute of Medical Science has submitted a curriculum for the nurse practitioner in emergency and trauma. So we are in a pro of developing the specialty programs so that we have to be closely work. Medical fraternity has gone from the MCH, and if our nurses have to work very effectively as a team member along with the medical team, we also have to catch up to the specialization. So in order to catch up to the specialization, we have to undergo this specialized program. So there will be a few more specialty programs in the form of the nurse practitioners are likely to come.
Thank you, sir. I think I would like to equate with the MBBS, like MBBS is a general program. So in the same way, we have GNM, ANM in basic BSc and post-basic BSc is a general program, and we have a NPM is a specialty like MD or a DNB. So you can equate with the DNB program, right? So you can't say I want a special cadre. What will happen to the already existing? Nothing will happen to the existing nursing people. They will be there as a core nursing personnel, and we have MSc in OBG. Yes, there are a teaching faculty. They will be our teaching faculty, and if they want to become a cadre, yeah, yes, sir.
But I just would like to remind our participants, please read this own report, State of the World Nursing Report. The State of the World Nursing Report has calculated the about 6 million nurses are required, and the 6 million nurses are required in the developing countries. And since India falls on the developing countries, now the WHO is all the regions like Southeast Asia region, the WHO like zero in Delhi, they are going to request all the zero countries and including the India to implement this own report. It is not going to be keep good because the ultimate follow-up is going to be done by the WHO for the State of the World Nursing Report, because this the first time the WHO has come out with the State of the World Nursing Report, the need is going to be there. You all know in India, our nurse-patient ratio has not been implemented. I think this is the beginning which we have to now. The already the assessment is being made that how our Government of India's staff inspection unit SIU norms, which is our Mrs. Kurana, the All India Federation is putting pressure to the Government of India to even this SIU norms are the outdated, and it is only these SIU norms is only for the one shift. They have to sanction for the 3 shift. This type of demand has already been put to the Government of India for the central government institution. The similar type of a process should start to the at the state level. Once if the states are agreed for the staff inspection unit norms, the requirement of the nurses are going to be like anything, because at present the many of the state run hospitals are not even having a closer to the SIU norms of the government of India. So therefore, the need is going to be there.
Thank you, sir. Do we need trained midwifery faculty from these centers, or we can conduct it without the state or national centers, or trained faculty from there? I think, Dr. Punita, we have that. That's why we have NPM educator program. Only these educators are with the faculty for the SMTIs, that is State Midwifery Training Institutes. Am I correct, Dr.
Yes.
Punita?
Yes, yes.
Yeah,
Yes.
thank you. I think somebody is asking about the curriculum. It's available on the Indian Nursing website, the Gazette notification. Please read in detail about the curriculum. I think President Sir has already answered your question on new institution can apply for this program. I think we have, and I think Pravina, Madam, you have asked something which is answered already. That why do we teach midwifery in the various INC approved? One has to have a basic midwifery, that is 6 months. That's all we have in general nursing midwifery as well as BSc. We have only 6 months course in the midwifery. That doesn't is equivalent to an NPM program. So that is different. So we need to undergo the 6 months programs to have an additional midwifery program as an NPM cadre. Can an ANM ever be trained as NPM in India? I think yes. If you want to go GNM, then you'll become eligible to NPM. Am I right? It's a question to the panelist.
Yes.
Yeah. NPM course comes under post-diploma program, and it is not a PG course. How much money needed for this course?
I think it's too early to make a financial assessment. I think various parameters have been already reflected to start this program. So it will be difficult to say that X amount of money is required to this thing. So various infrastructure facilities, it all depends upon the money is required on the basis of the what do we have in the at present. So we have to build on with the existing facilities. Then only you'll be able to make how much money is required. But I think various parameters have been listed out. It may not be difficult to for a X institution to assess how much money is required.
There is a question. If I qualify NPM course, can I open a clinic? Madam Mithali Adhikari, if you like to answer the question.
That's
if
why
I for this NPM, can I able to open a clinic?
Yes, I think she is capable to render the care to the antenatal, internatal, and the postnatal care, as because she is prepared like this only. But question is there.
You're not audible, Mithali.
Yes, you are not audible. Hello.
Yeah, maybe you have to remove the mask for 2 minutes, ma'am.
Okay. Yes. So she is prepared like this. She can open it, but the legal permission is needed. But she can do independently, as because she is prepared like this. But during the internatal care only, they need the hospital only. So that's why antenatal and postnatal she can do. Not a problem.
I think they will not be very far once we have 84,000 nurse practitioners are put in place. The visibility will be seen by the public how a nurse practitioner midwife can conduct the antenatal and natal and postnatal care in these things. Definitely, the next step is going to be there once the legally provision is given about the scope of practice of nursing and midwifery practice from the national regulatory body. Then the next step to be that she can open a clinic and getting a license, and she can required consultation. You can call the gynecologist and she can run. There is no problem. But
no problem.
A beginning, I think that's what I am always telling this. The ultimately public has to recognize us, yes, they are competent to conduct the protocols, whatever in a different specialty. Therefore, a big challenge and opportunity is given by the National Health Mission for this nurse practitioner midwives opening of 84,000. So definitely the visibility will be seen by the public, and the next course of action is going to be the opening the clinic.
Thank you, sir. I mean, many are relevant to their personal questions. I think they can ask us on the mail. We can answer them, because some institution who has some seats and how to add the seats, I think we can answer them later.
I think can we do one thing? We can all, I think, to give a due respect to the questions which the participants have raised. If we are not able to answer the question in this limited period, I think we can request Pearl to, and we can give a put it in the INC website. The questions and the answers.
Also, I think once we also put this video on the INC website. We'll also put this on the INC website so that people can see this video again. And we do have a detailed Gazette notified curriculum. I think people have to correlate both the things. And we also have an FAQ, sir. We'll also have, as we
so
said,
we
do that.
ensure these replies are given to the which the questions they have raised. Ensure that we will be able to, that video will also have the question and answer replies.
I think people have seen it, and the questions are almost similar. Almost all are same thing. Whether
I know, but still
yeah,
you can general. You can make a general classification of the.
I'm just telling whether to ask these questions to NPM panelists. But the questions are almost same. There's not much difference now, because we have already answered all.
I think there is one question coming up again and again about the scope of practice, whether what document is available in the public domain.
I think shortly we will be putting in the public domain, because already we had a consultation with the ministry. I think the ministry will be finalizing soon. As and when is approved by the ministry, we will be putting in the public domain in the INC website.
Dr. Puja, there's one question on the examination. So I think let's answer that. This is related to final practical exam of NPMs. Will they be examined in AN care, intranatal, and PN care separately? What is the duration of practical exam? Will it be conducted in ND?
The general guidelines are given to them. General guidelines for examination, for the NPM, right? The NPM, general guidelines are given, how many examiners and minimum number that can be examined per day. So they have the ASCII, and they also have directly observed practice. So they have to do it in different days. If they have only 10 students per day, they can't finish same day. So they may have to divide it in days, and then they conduct it. General guidelines are given. Then, but for directly observed practicals as well as ASCII, examination of midwifery, all components have to be examined. You can't separate it out, right? Every component has to be included either in ASCII or in directly observed practical. So nobody can say this is separate and only one aspect can be examined. All the aspects have to be examined. What cannot be examined in directly observed, you plan it in the ASCII. Okay, so that has to be kept in mind when you're planning for practical examination.
Somebody is asking about scope of practice, not in NNMC bill. I think it is there in 1 or 2 lines, not in detailed out. It will be available as in the regulations, because there is roles are responsible for each program. For like staff nurse, what's the scope of practice, and what will there's a teacher, what's the scope of practice, like that. It will come out as a part of a regulations.
See, even if you find one word of a scope of practice in a bare act of the National Nursing and Midwifery Commission, that is enough. once it is approved as a scope of practice, the main act is approved by the parliament, then you will be getting a detailing of the scope of practice, what should be the for the nurse practitioner midwife, what should be the nurse practitioner critical care, what should be the for the psychiatric nurse. So like that, it will be then the National Nursing and Midwifery Commission will be empowered to regulate the scope of nursing practice.
One person has asked about the NPM educator program in Uttaranchal, it is started or not. Last year I gave entry for NPM educator, but till now result is not declared. I think President sir has already answered, and Madam Mithali also, the Adhikari madam, that because due to COVID, we were not able to start because we can't do an online classes for this NPM program, NPM educator program. So it will start soon and you will be made aware of it if you are, and the results will be declared shortly.
Another important addition is going to be there in the to ensure the quality of the midwifery care, because since we are talking about the nurse practitioner midwives, we have already done this virtual training program, about 10 program for the faculty strengthening of the midwifery educators who are teaching in the GNM and BSc in colleges. And we are going to identify, we'll be bringing these educators back to our national state-of-the-art simulation center, which is there established in our the Indian Nursing Council, JAPAGO, and the SGT, and the we have established. I don't know how many participants you have seen that we are going to have a modular competency-based midwifery program is going to be already we have decided, and we are bringing the faculty to there. And similarly, the national midwifery educators who are participating, because they may not, all the national NMTs may not have these mannequins and the state of the art, the simulators may not be available there. So we will be bringing those people back to the national reference simulation center, so that we will ensure that the competency based midwifery curriculum is going to be implemented, bringing those nurse practitioner educators to the national center, so that we will be ensuring the competency based curriculum is implemented.
There is a question on NPM educator program. What's the age limit for the admission to NPM educator, Dr. Punita? I think NPM is clear, it's 45, less than 45, or maximum 45. But what is the age limit for NPM educator course, ma'am?
Educator, I don't think there is anything spelled out on age.
Yeah.
It was not there in the people.
Yeah, it is not spelled out.
Yes, ma'am.
So that's why the
selection from the state, I think the age has not been spelled out here.
Actually, depends on the state only. Who
depends that is the reason I am telling all the participants, and since Mithali is also representing SOMI and many of the state level, our nursing and midwifery professional associations has to be very alert to take up these issues with the respective mission directors. If you are able to be in touch with them, and where some outstanding educators are there, then definitely they will get an opportunity to be included by the mission directors.
Sir, I feel this is like more of a in-service education, although it is a short course. And in government sector, usually there is no, age bar for this, because we have had students coming from different states, even for Masters of Nursing, just 1 year before their retirement, 2-3 years left.
At the age of
I think
state governments have deputed for the PG program.
Actually, state
PG
government.
program. So I think we should not put any age. Let this this maybe with the live with the state governments if they want to impose any restriction on this.
I think state government generally their principle is any deputation they will expect at least 2 to 3 years after the training, she should be able to give this service. That
So
type of
that's
a
okay.
principle they will follow.
And
Can
MS
a MSc OBG be given a short-term refresher course to upgrade to be NPM? I think there's a n
No,
number of
it
questions
is
are out
already
there.
discussed.
Yeah, so Madam Mithali and Dr. Punita, if we can just answer this. Can a MSc OBG be given a short-term refresher course to upgrade them to NPM?
No. Actually,
no,
course
no.
is already there, na. What course is already
See,
there,
I
which
think
is
this is a
conducted.
similar question. This is the similar question which I think I might have
NPCC.
the discussion I had for the nurse practitioner critical care program.
Total different
Was a-
program. It's a
I'm
residency
just,
and totally
I'm
different.
just, I'm just telling because there was a big suggestion that in order to the MSc qualified people are not getting a job, why can't we give the MSc OBG, MSc medical surgical nursing people to given a short practitioner critical care? Council took a conscious decision that because the existing the MSc nursing program cannot be equal given some modular type of a nurse practitioner critical care to become a critical care nurse. That's why we are insisting that they have to go course of instruction of the 2 years nurse practitioner critical care in a residency format. I think the medical fraternity during their PG program, they implement a residency format of the training program. Similarly, our nurses have to be competent because now the government has given an opportunity. We should not have a shortcut. I think our people have to be trained with the competency so that the medical fraternity will recognize our specialty. And not only that, will the visibility in the eyes of the public also will be there, our competencies. So therefore, we should not think of any shortcuts. They have to undergo a course of instruction of these specialty programs.
There is a question.
I just want to add, Bharti, to this, request of the refresher course. I think we should not forget that midwifery is the only area where we find that students have such lack of opportunity for conducting the deliveries, working in the midwifery areas just for a restrictive period. They haven't had a chance to even conduct one single delivery as a BSc nurse when they get the degree. Even those who have done their masters in OBG, I know that they are not experts. So I don't think we should opt any time for the refresher course if we really want them to be expert midwives or the midwifery practitioners. They have to go through the educator program minimum. They can be teaching. Theoretically, they may be strong, but I think even theoretically, they will have to follow this new now the program curriculum that we have developed based on the ICM competencies and the WHO and Ministry of Health and Family Welfare. We should never bring this idea in our mind for a refresher course for the masters.
Yes, that's true, ma'am.
Not at all.
Well said. Well said. Thank you, ma'am. I also just want to tell you that NPM is a specialized course, but there's a question from a faculty that I understand that NPM is specialized course, but there needs to be a change from routine in the other midwifery program. I think you all have to attend a virtual training program, which is we are offering. I mean, every month we have one virtual training program for midwifery educators only. So please do attend and see what is we are telling you to incorporate in your teachings in the midwifery program. So anything you want to highlight, Pearl? Or Dr. Punita? I think Pearl, she's there. Yeah, Pearl, tell me if you want to highlight on this.
In our revised BSc syllabus also, we have incorporated a lot of latest educational technology. So the latest updates from the WHO and the guidelines, as ma'am very clearly said, it is given in the virtual training. And when our revised syllabus comes up, we'll have it in more detail there also. But again, we encourage you to attend the virtual training program for more clarity, because the educational methodology has to change. To reach out to our new generation of midwives, I think our way of approach, the way we deal with the students have to change. And to get an idea about it, you can attend the virtual training program. Yes, ma'am. Thank you.
So I think the faculties are requested to attend the virtual training. Though we are not telling you to, it's a free course, 6 days programs, only for 2.5 hours a day. So I think you should all attend for your concepts to be clear on the midwifery, and especially the latest concepts. So I think it's 1-5, and we have almost had all the questions answered because they're almost similar questions. So I just request you that we'll put on the YouTube the today's webinar, and then we'll have some FAQs answered on the website. Please go through that. Otherwise, you can always email us. We are there for you. Thank you. And thank you for the patient hearing from us. And I thank all the panelists over here to sparing their time. Thank you very much.
Thank
Thanks a
you.
lot.
Thank
Thank
you.
you.
Best
Thank
of luck.
Thank you.
And
Thank
thank you also,
Thank you.
INC.
Thank you. Thanks a lot. Bye.
Bye bye.
Bye-bye.
Thank you. Thank you.